All right, well, welcome everyone. Let's get started. It's a couple of minutes past the hour. I'd like to say good afternoon and good morning for those in the western part of the United States, and welcome to the first session of our virtual CleanMed series. We are pleased to be the first session kicking off this virtual experience for 2020. As I mentioned, thank you for taking the time to answer our short poll questions. If you haven't done that, please go ahead and still do that now. Ben, do we have the results of those questions? There they are, thank you. So question one, which represents the primary nature of your organization? We have about half of you that said hospital, another half said health insurance. Question two, who have been the main drivers of the environmental stewardship work at your healthcare organization? We've got about 50% leadership and about 50% other. Question three, does your organization have a formal environmental stewardship commitment statement that is signed and supported by leadership? Yes, no, or not sure. Again, broken down half and half, 50-50. And then our last question, what are the top two most important expected benefits of your environmental stewardship work? 100% says to mitigate risk. So thank you all for taking that quick question. It was kind of something fun we wanted to do to check out who our audience was today. Again, we'd like to welcome you, and I'd like to introduce myself. I'm Scott Rich. I'm the Director of Growth and Marketing for Practice Green Health. And if you will allow me to introduce our speakers for this session this morning. We're really pleased to have these esteemed speakers and presenters today. And we'll kick things off with Laura Gitman. Laura is the global expert on corporate sustainability with 2 decades of experience in strategy consulting. She has advised senior executives at global companies across a range of industry sectors and environmental, social, and governance issues to develop and enhance their sustainability strategies to maximize value for business and society. She's currently COO of BSR, a global nonprofit that works with its network of more than 250 member companies and other partners to build a just and sustainable world. Now I'll turn it over to Laura.
Thanks, Scott, and thanks so much for the invitation to be here today. I'm really pleased to help you kick off the CleanMed series. And what I thought I would do, Scott graciously invited me to come and give a bit of an introduction to what is sustainability. We know that many of you are at different stages of maturity in terms of your understanding of sustainability, the level of commitment that your organizations have made. And this is what BSR does. This is what we've been doing for more than 25 years across a wide range of industry sectors. And so I think my job is to really introduce sustainability and to ground it in why it makes sense from a business perspective. So what are the benefits from really investing in sustainability? And then we'll turn it over and see 2 really specific examples of organizations that have great commitments and great progress on their efforts. So just by way of background, BSR is a global nonprofit organization. We are a membership organization and work with companies across a pretty wide variety of industry sectors, all in the service of one mission, which is to create and build a more just and sustainable world. We do have offices, 2 offices in the US, 2 offices in Europe, and 4 in Asia, and work on a pretty wide variety of issues. So when we define sustainability, we define it quite broadly. So looking at both environmental issues as well as social issues and ethical and governance issues. And the way we organize the work that we do is in 4 overarching types of impacts. So impacts on climate change, on a more inclusive economy, on human rights, and on diversity and equity and inclusion. But then we also work with organizations on the how to really achieve those impacts. And that means how you actually work within your supply chains to embed and integrate sustainability attributes, as well as how do you work across the organization, and that's what we call sustainability management, to transform your business to be able to manage a wide variety of issues that fall under some of these impact areas. We do have a long history with healthcare. Although I would say much more in pharmaceuticals and medical device than we do than the sectors that many of you are coming from today. So it's a real pleasure to get to partner with Practice Green Health and to bring this content to you today. I will also just say all of BSR's research and content is publicly available. You do not need to be a member to access it. And so I encourage you to check out BSR's website and to take a look at the areas of content that are interesting to your particular organization and the priorities that you might have. So what is sustainability? And as I said, for us, it's really important to define sustainability more broadly. And so there are some organizations that might hear the word sustainability and think of it as only environmental sustainability. And we really do define it in a much broader way. The definition that you see up on the screen here from the Brundtland report is one of my favorite definitions, because I think it really puts into context why we're talking about sustainability in the first place. And that is to allow development to meet the needs of the present without compromising the ability of future generations to meet their own needs. So it really is that concept of being sustainable so that you can sustain oneself into the future. And that means sustain your organization, sustain your business, but also sustain the society and the planet on which we all live. Another definition that really touches on the wide variety of issues is this one that talks about sustainable business being a business that delivers value for investors, customers, and employees. So really thinking about value creation in that broader set of stakeholders. Improves the living conditions of those it touches. So the employees, those in the suppliers and its communities, makes wise use of natural resources and treats people fairly. For those of you who have been in this field for some period of time, you may have noticed an evolution of terminology. And so back in the 90s, the term that was most common was around this idea of corporate responsibility or corporate social responsibility or CSR or corporate citizenship. And in that wave, it really was around making sure we're not doing harm, making sure that we're in compliance, but not really going much beyond that. As we moved into the next century, we started to see a shift from that terminology, not across the board. There are plenty of organizations that still use those terms, but we did start to see this shift towards the terminology of sustainability. And at the same time, that was around increased globalization, more of a focus on compliance and issues outside your four walls and really getting into your supply chains. And as that evolved even further, really thinking about how does this actually make for better business? So not having a standalone sustainability department that only focuses on those impacts, but really having that department have a mandate to change how business is done and to integrate it into the business. We've also seen in the past couple of years the beginning of a shift towards the terminology of ESG, which stands for environmental, social, and governance. And that has largely been driven by much more investor interest in these topics, which has really been pushing ESG integration into investment decision making. As we look forward and as we look to company commitments that are starting to come out now for 2030 and 2050, it's actually pushing even beyond this integration concept into the idea of a restorative economy. So not just what are you not harming, but what are you adding to society? How are you making sure that you're having positive social and environmental impacts? And that is still quite nascent, but a wave that I think we can expect to see more of in the next couple of years. Even within each of those waves, every organization is at their own place in terms of maturity. And typically what we see, and it was interesting in the survey results, that many of you are still in the risk management focus. And that is a bit more nascent. It is, first and foremost, managing the specific risks, looking for cost and efficiency gains to be had. And there are many of those to be found in the sustainability field. As you get more established, you're able to move much more beyond simple risk mitigation into more of a focus on opportunity and value creation. And that's where there's a lot more opportunity, because then you're not just managing risk, but you really are tying your investments in sustainability to an ability to create value overall. And I'll get into some of the examples of that in just a moment. As I mentioned, a big shift in recent years has been the push from investors. And there were two pretty big developments in the past couple of years that I think have really crystallized this shift. One is the attention of very mainstream investors. And so there's probably no more mainstream of an investor than BlackRock. They're the world's largest asset manager. And Larry Fink, in his letter for the past couple of years, has been very explicit around the fact that they are looking for companies to not only deliver financial performance, but show how you are making that positive contribution to society. And then last summer, so we've just passed the 1-year anniversary, a really important statement from the Business Roundtable, which had always been fundamentally very focused on the fact that a business's core responsibility and commitment was to its shareholders. And they changed that to say that we share a fundamental commitment to all of our stakeholders, not just our shareholders. At BSR, we are also recognizing that these issues are in a very different context given the current pandemic. And so one thing to think about as I talk about sustainability, given all of these other competing priorities right now, is the need to both meet the moment, so respond specifically to the economic, human health, and social and political uncertainty that might be created or exacerbated by COVID-19, but not to forget that long term and not to forget about the need to build for the future. And there's a lot of talk around making sure that as we rebuild, we are rebuilding in a way that is more sustainable and that enables more shared and sustainable prosperity. BSR released a couple of months ago, I believe at the end of July, we have a Healthy Business Coalition, which is made up of members who are in the health sector, as well as companies who are not in the health sector. So it's a cross-industry group funded by the Robert Wood Johnson Foundation. And we released these business actions for a healthy society. So these are available on our website, and I encourage you to take a look as well. There are case studies and examples of each of these commitment areas, which are a really nice way to pull together the different ways that business can contribute to a healthier society. So how does sustainability drive business value? And Scott asked me to really focus on this. I think because for many of you, you are still responding to interest from leadership, but you have not yet necessarily gotten to the point where you have been able to document and understand and be able to have the confidence that sustainability is not an additional cost for your organization and that it really is driving value. And the way BSR thinks about this value creation is across many levels, but we like to organize it in these 5 key areas. So from a finance perspective, I already talked about the fact that investors are interested. We're seeing lenders who are saying that strong ESG performance lowers your cost of capital. It means you're a less risky organization to partner with. It might provide access to new markets, such as impact investors. So there's a finance perspective. There's also a lot of opportunity on the marketing side. So increasing your brand value, your overall reputation, being able to respond to both consumer and B2B customer, or for many of you who serve governments, government funders, government customers as well. There is a talent benefit, which is around improved attraction, engagement, and retention. And there's a lot of evidence that backs up the fact that this might be one of the most important benefits of sustainability. There's a pure operational benefit, so that is in that compliance and efficiency and cost savings mode. And then there's a really interesting set of benefits around innovation, and that when you start to think about sustainability, it actually opens up a number of new sources of thinking. When you look to eliminate waste, you end up finding processes that could be redesigned in a much more innovative and impactful way. And so there's an important innovation angle as well. So just to get a little bit and give you some data on some of these areas, and BSR surveys our members once a year. So certainly, it's not an exclusive survey, but it is a survey of 250 of the world's largest companies. So it's pretty indicative. And what we have found is that reputation remains the most powerful driver of sustainability. So it was interesting that not many of you talked about reputation in your drivers. And that is followed by consumer or customer demand, and then investor interests. And then, just behind that is that operational risk and benefit. You can see some of the other areas that I talked about that were lower in terms of some of the drivers, but perhaps might be where there's even more of a benefit that could or should be explored. So the consumer angle is quite powerful and is one that is perhaps moving the fastest in certain sectors. There's research that shows that nearly 90% of consumers will purchase a product because they believe the company cares about the issues that they care about, or that they will refuse to purchase a company's products or services if they support an issue that is contrary to their beliefs. And so both of those numbers are quite high, and so something for companies to really pay attention to, especially in today's hyper-transparent world, where the access to what those company positions are and the ability to share this information is quite free-flowing given social media. Related to this idea of reputation is this idea of citizen trust. And there is a general philosophy that it is much easier to lose trust than to gain trust. And so if you have citizen trust, a lot of the efforts around sustainability are really looking to lock in and to reconfirm that citizen trust. In a survey that was conducted last year by Accenture, nearly 3/4 of CEOs believe that citizen trust will be critical to business competitiveness in the next 5 years. We talked about investing, and I shared the quote from Larry Fink from 2 years ago. His letter this past January was even more explicit, and saying that sustainable investing is the strongest foundation for their client portfolios going forward. So this is not something they are doing on the side. This is something that they are doing across all investments. And I can tell you that since this letter was published in January, and during a lot of the market volatility during COVID, sustainable investments, or investments that were ranked higher from an ESG perspective, outperformed the market. And so this idea about using this as a lens for better returns has certainly played out well. I did want to spend just a moment on the talent conversation, because I do think this one is one that is perhaps underappreciated. And for many of your organizations, given that your approach to reputation and consumers might be a little different than other kinds of organizations, I think the talent angle is incredibly important. So how does talent impact, how does sustainability impact talent? It increases loyalty, it increases retention. We find that many millennials will accept a lower salary to work for a more environmentally responsible company. There's evidence that they believe that business professionals believe that they're more proud to work there. That leads to higher engagement levels. It often leads to higher productivity, lower cost of hiring, lower cost of turnover. And we're also seeing, and it's not here on the slide, but we're also seeing a real impetus around employee activism. So this is all the positive statistics, but we're also seeing if you're not doing the right thing and you're not investing in sustainability, that your employees are more likely to call you out for it and to really make that an issue, whether it's on diversity, equity, and inclusion issues or on your environmental performance. What I wanted to close on is just the fact that, again, I've heard a little bit of conversation over the past couple of months. Well, we can't afford to invest in sustainability given everything else that's going on. And what we have found is that actually ESG provides a real stable foundation right now, and that this is not the time to shift away from your sustainability efforts. We've found that the issues have been exacerbated, and the attention to these issues is only growing. And so the issues around human rights and equality, women's empowerment, are even more important now, and you're seeing employees, investors, regulators really start to pay more attention to that, and you can expect that to continue to grow. So with that, I again just want to thank you for the opportunity to speak to all of you. I'll turn it back to Scott and welcome your questions at the end of the session.
Thank you, Laura. I really appreciate that. Definitely great definition into sustainability and where things currently stand. I wanted to share that for all those who are asking, we will be providing the recording of this virtual series and the slides by email. So all of our Attendees who have registered will get an email with all of this, so thanks for asking. Next, I would like to, let me see if I can share my screen here. Bear with me here. So next, I'd like to introduce our next speaker and presenter. Kathy Bender-Swick is responsible for chaplaincy, pastoral education, church affiliations, environmental affairs, and sustainability and ethics at Advocate Aurora. She leads staff well-being across the system, and she's been with Advocate Healthcare for over a decade and has more than 30 years of experience in spiritual care and executive leadership. Kathy is a graduate of the Harvard Kennedy School of Women in Leadership program, holds graduate certificates in healthcare management and patient experience leadership, and is a fellow in the American College of Healthcare Executives. I'd now like to welcome Kathy.
Thank you very much, Scott. And I will share my screen. It is great to be here with all of you, and thanks to Laura for your fine kickoff of this topic. Really inspiring. As you heard my bio, it sounds like I oversee a broad, diverse area of functions on our executive leadership team. But when it comes to our sustainability effort, it really helps connect some of the dots, as you will hopefully hear as I present. First slide is a disclaimer for opinions and photos. A little bit about who we are. Advocate Aurora Health came to be 2 years ago when Advocate Healthcare merged with Aurora Healthcare with the vision of reimagining health and transforming care. We doubled in size as an organization and now extend from north up in Green Bay, Wisconsin to the south side of Chicago. We encompass urban and rural settings, serving in a variety of communities, but all with the purpose of helping people live well. An overview of what I'm going to cover during our time together is our journey, how we first got traction for this work, our relevance to purpose, always connecting back to the why of why we exist as a healthcare organization, measuring progress, how we keep the traction going, holding ourselves accountable for what we're doing, and how we connect our sustainability efforts to our commitments to building community resilience. The business case for sustainability started in 2006 with building plans for a new bed tower and lead project at one of our flagship hospitals in the Advocate Health system, which required a green team to be formed in order to optimize recycling of materials in the new building. From that grassroots effort sprang interest at the system level to form a system-wide effort to adopt the best practices in sustainable hospital operations, which primarily involved reducing waste and energy. It quickly became clear that not only was this work important in preserving natural resources, but also the health of the communities we serve. Another significant motivator was our desire to be good stewards of our financial resources as well, and we quickly realized bottom line benefits from our energy reduction achievements. There were so many benefits to reap from this work that the system created a director of environmental affairs and sustainability, and in 2011 hired Mary Larson to create and lead our program at Advocate Healthcare. This set in motion an assessment of the priorities and annual goal setting, along with an intention to cultivate a culture of conservation through education and communication aimed at all levels of our staff. This buy-in and understanding was essential to changing personal behaviors about everything from proper waste sorting to electricity consumption, or even the hoarding of supplies by some of our staff. The Advocate executive team and board of directors have considered this a top priority, primarily because of stewardship of our resources, that's priority in the organization's values and a cornerstone of Advocate Healthcare's faith-based belief system. Today, as a purpose-driven organization, Advocate Aurora Health has matured in its aspirations as a community builder, whose responsibility is to address all upstream opportunities we have to shape more resilient communities that we're privileged to serve. So we are a purpose-driven organization with our purpose being helping people live well. And you can see then how this impacts our environmental sustainability work. We help people live well by treating our patients in the present without compromising the health of future generations. Everything we do, we ask, how will this impact the generations that come after us? We wanted to change a culture and create a mindset of conservation. How did we do this? Through education, educating our leaders as to why this is so important, educating our leaders about how to change behaviors of those they lead when it comes to recycling, reusing, reducing. We did it through communication, that we value our executive team, our board, our leadership values a culture of conservation, and that stewardship of resources is something that we're very committed to. And we do it through recognition at the local level as peers nominate their peers for great things they are doing in this area, and through our lifting up our national recognition. And you can see on the left, we believe that a healthy planet means healthy people. Laura referred to responsible corporate citizen. We do that not only at reducing harm, but also giving back, contributing to the health of the community, as we do with our public and community health efforts. And as Laura mentioned, attracting and retaining the best talent, folks who are committed to being on this journey with us, and also in transforming our supply chain and shifting the market. This is what we mean by being accountable. Our system has this kind of a report card that we lift up, and each of our sites of care has a similar report card that measures how they are doing in all of these areas that we measure regularly. And I like to point out there at the bottom where it's 8% reduction in paper usage. If we tell 70,000 staff that we've reduced paper by 8%, that doesn't mean much. But when we say it's the equivalent to the height of 8 John Hancock buildings, that really brings home the impact that we're having and the difference we're making by saving money, reducing CO2 emissions, and leaving our planet a little healthier. What you have here is a photo montage of our 10th annual recognition event. These are folks who won awards. Again, they were nominated by their peers for what they are doing either to improve their own health or to improve the health and well-being of the planet. And some of the exciting things here are these are grassroots ideas that we have embraced and encouraged people to move forward with. And now several of them are system-wide because we have embraced them because folks have lifted up such great ideas. Here is national recognition. Our merger did not slow us down. You can see that we brought together two systems who were very committed to this. And in addition to the wonderful recognition we've received from Practice Green Health, 10 years and the System for Change Award, we've also received recognition from the US EPA, from the Vizient Group Purchasing Organization, and from Becker's Hospital Review. Health equity and addressing health disparities are also priority issues at Advocate Aurora. So we are tying our environmental sustainability commitment to our other community commitments, again, as we focus overall on helping people live well. Our organization has an expanded consciousness. We certainly look internally, deep within ourselves, for what we could be doing to better care for our environment. But as we see things like the headlines here, we're also looking at what else can we do to make an impact out there through our efforts in advocacy and change within the healthcare space. A great story I love to tell is we had a group of physicians in Wisconsin who came together and expressed concern, their kind of moral distress, if you will, over how they are working to improve the health of their patients, but then sending them out into an environment that is affecting their health negatively. So they wanted to come together and create a coalition for change. And that is something, again, a grassroots effort that we said, absolutely, what can we do to help you move this forward? Addressing health equity is a central priority for our organization. Studies show the differences in life expectancy by zip codes can differ for people who live only a few miles apart, with many reasons behind this stark difference. We strive to look honestly at our own unintended contributions to environmental harm and to be advocates for those who may face environmental threats in their neighborhoods. And you can see a commitment there in this slide. We leverage our purchasing power for good through reducing pollution and emissions, minimizing waste, supporting a circular economy, supporting local and diverse owned businesses. How can we use our resources and buying power to help people live well? Sorry. Intentionally weighing sustainable and socially responsible factors as we make purchasing decisions enables us to leverage our purchasing power for the good of the communities we serve, while also meeting our organization's needs. Examples of this include working with suppliers and their supply chains to reduce the emissions from transporting product and services, minimizing waste and partnering to support innovations in a circular economy, supporting local and minority-owned businesses by setting goals and requiring accountability at all levels of our organization, and specifying only products that don't contain chemicals of concern to avoid exposure during manufacturing, useful life, and disposal. With these and other differentiating factors between suppliers, we aim to create local economic vibrance and increase health equity for all, no matter where they live. Advocate Aurora Health publicly announced its commitment to using 100% renewable electricity by 2030. Our primary rationale for this decision is to help people live well. If healthcare's emissions were cut by even 30% by 2030, we could prevent significant reductions in premature deaths and respiratory events and medical costs. We plan to achieve this goal by doing several things: installing on-site renewables where it makes financial sense, purchasing renewable electricity from sources generated off-site, and renewable energy credits. Over time, the benefits equate to significant reductions in carbon dioxide and healthier air, which is vital to fighting chronic respiratory diseases like asthma. We are working to connect and integrate social and environmental criteria to purchasing and investment decisions, in addition to other priorities such as optimal return on investment, quality, and safety. Again, all focused on helping people live well. Some key takeaways. Always connect to purpose and mission. This helps people connect the dots, and it's not just an interesting area to pursue, but really helps us raise the question with every decision we make: how will this impact the environment and what we're leaving to future generations? Be sure to set goals and measure progress along the way and celebrate successes. Culture change starts at the top. This was something that our executive team and board embraced while all of these other grassroots things were happening, and we were able to connect that passion across the organization. Again, communicate, educate, and recognize. Folks get really excited about working for an organization that is committed to this, and so we recognize their passion and their efforts. Leverage all resources for optimal social benefit, and do more together with community partners. We can do a lot more together than we can individually. Thanks very much for your time today. It was great to be with you for this presentation.
Thank you, Kathy. Really appreciate you. Also wanted to mention before we go to our next panelist that if you've got questions for any of our panelists or just in general for the session, please go ahead and put those in the chat box, and my colleague Janet will help me curate those, and we'll try to get some in at the end. So our next panelist is Mary Engvall. Mary is an accomplished corporate responsibility strategy, metrics, and reporting professional. She spent the past decade focused on building this function within companies to create value for business and society. Mary's work involves integrating comprehensive environmental, social, and governance performance objectives into business strategy to create social benefits, operational efficiency, brand equity, employee retention, and competitive advantages. And now, Mary, I'll turn it over to you.
Great, thank you so much, Scott. And I will share my screen. There we go. Is everyone seeing that? So thanks, everybody. Really great to be here. Loved hearing everything that Laura and Kathy had to say. And you're going to see a lot of the same themes, which I think will be helpful, because when you kind of see this over and over again, but done differently for different companies, I think it helps kind of form a bit of a roadmap, makes it a little more clear about how you might adopt these same things for your company. So as Scott mentioned, I'm the Senior Director of Corporate Responsibility at Cigna, and many of you probably know Cigna, but we are a global health services company with about 75,000 employees operating in 30 countries. And there we go. So I just want to kind of take you along on our journey. I think very much the way Kathy had described, I will tell you, always think about these things through the lens of your own company's unique mission and your own company's unique resources, whether those be human resources or financial resources. But that's really kind of how every company can come to this and make it not a tacked on box ticking objective, but really a way of operating a business to the benefit of both your stakeholders and the broader society. So for Cigna, we started this by asking questions. And again, I highly recommend taking the time to talk to your stakeholders, understand what they want to see. Where do they think you should be playing? What do they think you should be doing? Looking at the materiality, what really, in our case, makes a difference to a health services company like Cigna. Where can we do something where our resources, where we really consider ourselves an expert? So therefore, we feel like we can really make a difference. So that's how we started. And as you'll see here, we kind of sadly found out that we were a laggard among laggards back in 2012. So the insurance industry overall, we're laggards. Health insurance, and we've evolved beyond being a health insurance company as a full health services company, but nonetheless, among our competitors, also a laggard. So what we worked to do was put together a platform, and that's what we call Cigna Connects. So again, that's the unique way that Cigna approaches these topics that only we could do because of what we bring to it. And it includes kind of our vision, strategy, structure. And then the first annual Cigna Connects Corporate Responsibility Report. I want to talk about this for a second because the reporting didn't get a lot of conversation so far, and I think it's a really important piece. And so I want to just kind of mention to you that it is not the end all and be all, but it is a discipline around performance metrics and transparency. And I think that's really critical. Kind of go back to the business adage of, what gets measured gets managed. And I think what gets reported, because it's measured, definitely gets managed. And this is really where you're able to show the proof in the pudding, but it's also where you will be transparent about your challenges. If there's anything you take away from this, please take away that this is a journey and none of us are perfect. None of our companies are perfect. But if we are working towards these things and if we explain, how we are doing it and maybe where we have challenges and how we are going to address those challenges, then that's really what stakeholders are looking for. And so that was really our first focus. I'll also just, kind of mention quickly, one other place to kind of start as you think about materiality, if you are at the beginning, is really using some of the standard frameworks for this sustainability accounting reporting. So whether it be the Global Reporting Initiative or the Sustainability Accounting Standards Board, or TCFD, some of the others, I think that's a really good place to look deeply and figure out what makes sense for what we do, what our mission is, and what we bring to the table through our resources. We then decided that we wanted to be a signatory of the United Nations Global Compact. You see we did that in 2015, and those are kind of 10 principles around the way we do business and weave all these topics through our business. Additionally, that reporting is important for some of the ratings and rankings. And so again, any of you that are involved in this, frankly, some may be involved because of the ratings and rankings. Sometimes senior leadership, their first introduction to this is seeing their company either not make a particular list or not be, where they want to be on a particular list. And so I think really understanding, what are stakeholders looking at? What do they think is material for you? And are you kind of keeping up with the level of ambition that, right now is considered, kind of what excellent would look like. And so we certainly, use a lot of those ratings and rankings to help guide some of our work. Dow Jones Sustainability Index is another, and so you'll see that we completed the corporate sustainability assessment for the first time in 2017, and happy to say that we were included on the index and actually is the leader for our subcategory. And so then we continued to kind of develop. And again, I would, for some of you that are maybe in the middle of your journey, this is where we said, okay, we've got the foundation built now. How are we going to kind of raise this building and what's it going to look like? And so kind of putting some of those pieces in place was really around target setting and around focus areas. And I'll show you a little bit more about that in a minute. And then where we are kind of today with a number of different projects, but one in particular that kind of brought me to practice green health is around supply chain sustainability. And Kathy talked a little bit about that in her presentation as well. We are continually, this never ends. You're never done, and I think that's a good thing. And so, as Laura pointed out, the way this has evolved over the years is initially it was more kind of a risk-related, compliance-related, inside the four walls of a company function. And it has grown to be, much more about the opportunity and also, kind of what are you kind of downstream or upstream? What are you able to leverage to help, do more and do it better? And certainly supply chain sustainability is one of those things. And then we, as some of you may know, acquired Express Scripts at the very end of 2018. So we have just completed the corporate responsibility report on 2019 when the year ended, and that was really kind of our first combined report. We are now going to, and so again, keep in mind, sometimes these things get put off because there's, maybe an acquisition that's going to take place, or maybe you're going to be acquired, or maybe there's, changes within a business strategy or division. I would say try not to let those things stop any of the ESG work that's happening, because it needs to be part of it always. And so where we are now as a newly combined company is setting a new set of 2030 long-term, measurable, meaningful, bold goals, and those will be targets in all of our focus areas. So as I mentioned, you know, where we were kind of midway through our journey so far was maturing to the point where we could say, okay, you know, what does this mean specifically for Cigna? And so you'll see, you know, kind of typical traditional 3 pillars, but the first one, health and well-being, is the one I want to talk about in the sense of it being very mission driven. So, you know, again, if we were not a health services company, I don't know that one of our pillars would be all around health and well-being. But as you can see, you know, these are the different things that we focus on. So sustainable healthcare systems, health equity, health promotion, disease prevention, and investing in the health of communities. And then, of course, our environmental work is also tied to the concept of the intersection between planetary health and human health. And so again, always looking at it through that lens of your own mission. And then again, inclusive business, which I think really for all companies, these things apply. And certainly now with a lot of the social justice issues, bringing some of these topics more to the forefront, you know, really important for companies to not only pay attention to, but to take a leadership role on. So on the supply chain sustainability program, as I mentioned, you know, so now we're kind of closer to today, if you will. We started this about a year and a half ago, and we are still in the process of standing it up. But I liken this concept to when you were maybe a teenager and you were going out and one of your parents said, you know, where are you going? And you said, the library. And they said, who are you going with? Why do they want to know who you're going with? Well, we all know the answer to that question. And that's why supply chain sustainability matters as well. You know, these are companies you are doing business with. And so you want to do business with companies that are, you have the same set of values that you do and are doing business in a way that you also feel is responsible. And likewise, where you are in the supply chain of your clients. You know, I certainly see in almost every RFP that comes through Cigna's doors that there are questions for me about, you know, what are you guys doing? And so this is something that we are in the process of setting up right now. You can kind of see managing risks, reducing costs, and increasing revenue are really, you know, some of the risks and opportunities as to kind of how we are approaching this. And again, you know, kind of standard building blocks, I think, but I'll show you in a second kind of how we've done it in somewhat of a unique way for Cigna. But, you know, again, start with that awareness. We are in the process right now of interviewing kind of, you know, a set of key suppliers on some of these topics as we start to kind of put these things together. I think it's really important to do this in collaboration with your partners instead of creating it and kind of delivering it to them and saying, here, this is what we think is right, you know, please do this. So that kind of brings me, you know, to the end of this piece, which is, you know, what we're doing now. And as I mentioned, you know, we've kind of created this roadmap for our sustainable supply chain program. The 7 key areas, and certainly, you know, if any of these feel right for your organization, you know, feel free to use these concepts. But this is really where, you know, we drilled it down to. So 7 areas are commitment, communications and reporting, supplier evaluation and selection, sustainable sourcing, generation of business value, and partnerships and collaborations. And where we want to go with this is we're going to start with basic programs in all 7 areas. And then, you know, we do hope over time to kind of, you know, continue to benchmark and get ourselves into a kind of a best in class when it comes to supply chain sustainability. But certainly there are, you know, many other examples I could give in terms of, you know, all of the different Cigna Connects corporate responsibility initiatives that happen throughout the organization. And as I always tell people, I don't do this work. I help the company kind of tell that story, and I also help them understand, you know, where are things going, and how can we meet those expectations? And that's where the opportunity side comes in. And to be honest, that's the piece. I mean, the risk side is certainly important, and reputation is a very real thing. And the reporting is important because, again, it shows transparency around your commitment to performance. But for me, the thing that kind of gets me up every day and gets me excited about doing my job is the opportunities. You know, what are the opportunities when we're looking at things through that corporate responsibility lens that we might not have seen otherwise? And I will stop sharing my screen.
Thank you, Mary. I appreciate that. Before we jump into Q&A, I just want to just comment that I love how all of our experts spoke about their journey. I think a lot of us really talk about sustainability. We definitely know it's a journey. Sometimes we call it, you know, a marathon instead of a sprint. But the journey aspect is, I think, is really something that we all recognize. The other thing that was great too is the three different organizations sharing the why and the how of why they're keeping sustainability front and center, and really appreciate each of your perspective from your three different organizations that are related to healthcare and our mission at Practice Green Health. I know we had some glitches earlier with the survey or the poll results. Ben, if you want to pop those up now, thank you. So that maybe makes a little more sense than the results that I shared earlier. So please feel free to scroll through that if you're interested. And again, I want to thank Mary, Laura, and Kathy for their insights today. And I know they're available for questions. So if there's any questions that are in the chat box, I'll ask Janet to unmute and share a couple of those, and we'll get some questions answered.
Thank you. This is Janet Howard speaking from Practice Green Health. Thank you so much for the chats that have come in so far, and I would urge you to keep putting in some additional questions if you have any. Well, just looking at the post results here from the poll, number 2, who have been the main drivers of environmental stewardship at your organization, it's interesting to see that of the over 200 participants on this call, there's more that are grassroots efforts than those that are led from leadership, which leads very nicely into one of the questions that we had for our panelists. So if a hospital does have more of a grassroots effort to date, how do you suggest that they get the attention of their leadership for a more coordinated effort? I'd like to start with Kathy.
Good question. I would suggest that some of those grassroots individuals find a spokesperson or a leader and find someone they can talk to and share their passion. We had an interesting evolution of some grassroots folks who were really, really interested and passionate about this, along with leadership who was, so that helped. But for the grassroots folks to find a leader who can speak to other leadership about this, take it to the executive team and say, here are some things that are happening and why we need to do it. Like the group of physicians did in Wisconsin, who said, this is important to us as physicians in this health system. How can you help us move this forward? Would be an example. But finding one person who can take these kinds of things to the executive team and say, this is important for us who are in healthcare to care for health beyond our 4 walls, is a way to get that moving.
Thank you, Kathy. Laura Gitman, would you like to add any additional comments?
Sure. And I think it's a really important question. You know, one of the things that I get asked a lot about is, well, what do I do if, you know, my job is not about sustainability? And I think that question is somewhat related. And in many ways, I think that's more important, right? Is, you know, there's a tremendous need for the formal roles around sustainability. And I think we heard the impact of that. But that informal, looking at ways that you can make a difference in your particular role, that's how this gets integrated into really changing the way that our practices work. It's not going to be from a top-down massive policy change. We might need both, but the idea generation coming from those who are closest to the processes and closest to really seeing the opportunities. And so I encourage everyone, I think it's a great idea to find a sponsor or a spokesperson or a way to help to elevate your interest in change, but also to recognize the opportunity for you to embed that in whatever your formal role is. There are sustainability impacts everywhere, and once you start paying attention to them, you'll see lots of ways that you can help drive change.
Thank you. And Mary, would you like to add anything?
Yeah, I would. So what I would add, because I agree with both of those comments, is sometimes it also helps to get the competitive juices going. So if you can do some benchmarking and show, you know, kind of either how some competitors are doing, or how, you know, depending, you know, possibly an investor makes sense there, or another stakeholder group, you know, kind of just put your organization in comparison with some others on the topic, and then offer suggestions for, you know, kind of solutions to improve that. I think with us starting with the stakeholder assessment and having a third-party organization show us that we were a laggard among laggards, honestly, really, you know, kind of helped put a little fire underneath it.
Thank you. I'll just add that if you're a member of Practice Green Health and you don't quite feel that your engagement with your leadership is where you're hoping it could be, that's something to mention to your member engagement manager. We are refreshing some of our foundational documents and going through a focus group right now to offer additional tools to help you find that executive champion, your clinical champion, for example. So thanks for that very important question. Our next question is about how has COVID changed sustainability work? Are you able to track, for example, savings from non-essential employees and working from home? I will just say, first of all, that we know from our members that there's a huge spectrum to that answer. So I will ask Advocate Aurora to answer, but just know for the person who asked the question that the answer for this really is a broad spectrum among our members. I'm going to actually ask Mary Larson to answer this question, who has joined Kathy from Advocate Aurora. Mary?
Janet, thanks so much. You know, for us, I actually think that this is a great opportunity for us to continue to track some of the negative impacts of the COVID disruptions operations and some of the wins. We do continue to track things like paper usage. As you can probably expect, we've seen a huge decline, exceeded our expectations, because guess what? We found out we don't need to use as much paper. And that was, as you saw, one of the metrics that Kathy talked about. But we also clearly know about the reduction in emissions from the lack of driving. For a lot of our associates, our team members that have not needed to go anywhere because they're all working remotely at the moment. But I do think that, on the other hand, we've seen huge increases in waste with all the disposables. So there are definitely impacts on our priorities, on our collective priorities in healthcare. But I do think that this is going to help us continue to shape the story around opportunities like reprocessing things we never thought about before that we can continue to do post-pandemic. And I also see, as many of you probably already can expect, the reduction in commuting and real estate that will be a benefit post-COVID. Because we're going to, I think, end up seeing a continuation of so much of this efficient work day that we've built into this COVID world, you know, where we're not moving around as much and we're able to do much more with technology. So the answer, I think, is that yes, this work has not gone away. If anything, much of this work is now more important than ever. And I think the connection to community resilience, as Kathy pointed out, has a new purpose, that sustainability along with diversity, equity, and inclusion coming together is, I think, the path that we're all kind of falling into now as important to keep our eyes on and even weave those metrics together to look at the health impacts for our communities that sustainability and health equity bring.
Thank you very much. The next question we just received was, how do you balance climate concerns with other environmental sustainability concerns? Kathy and Mary, I think I'll start with you again on this one.
Go ahead, Mary. I'll turn that one over to you.
Thanks, Kathy. Well, I will say that we see them as the same. They're really not separate. I think that the idea that healthy air is important to healthy people. And we need to first look at our impact. And you saw a slide there about mitigation and resilience, for instance, and looking at our own ability to mitigate our contributions to potentially to pollution in the communities that we serve is our first step. And our leadership is very much engaged in this. You know, we see anesthetic gas practices and reduction of, you know, very powerful greenhouse gas emissions as one of our key cornerstones in that effort. But certainly, you know, our 100% renewable electricity goal and all those efforts to clean up and pollute less are connected to health and connected to climate and changing climate. So again, these are not two separate topics for us. They are, again, the cases are made for the fact that this aligns with our mission of helping people, our purpose of helping people live well, and that we do need to engage. And we're using our resources to make changes and create strategy around this. So it's very seriously considered, and as I say, very closely aligns to our purpose.
Thank you very much. And that's Mary Larson was speaking from Advocate Aurora. For our final question, this is for you, Mary Engvall from Cigna. Could you please provide a specific example on how you're driving sustainability and supply chain in a measurable way? How are you measuring that progress at Cigna?
Yeah, so as you kind of saw where we are on the journey, we are not there yet. So what we have done so far is made the business case to the supply chain team, you know, working throughout procurement. And then, you know, once we got the buy-in and the resources from our procurement area for somebody to kind of lead this, we have then been working on reaching out to suppliers to kind of, you know, set up what are the things that we will measure and how will we get that information from them and how will we do it in a way that actually makes a difference. You know, just to say that yes, we've asked our suppliers and they've given us these measurements and then what? You know, if we don't do anything with that, really all we've done is make work for everyone. So it's a great question. It's absolutely what we are looking to determine right now. But as I mentioned, we are doing that in collaboration instead of deciding for our suppliers what we will be asking of them. And we want to make sure that, you know, what we measure. So for instance, greenhouse gas emissions will likely be one of them. We'll want to make sure that, you know, that then there is a next step to that. So if a supplier comes back and says, well, we're not measuring greenhouse gas emissions, then there needs to be, you know, either, you know, a conversation around, you know, how do we help you learn more about doing that, making a commitment to such a thing, or, you know, how would that impact, you know, Cigna doing business with companies if we're, you know, going out to bid. So it's a great question, and it's absolutely at the heart of it. But as of today, I don't have an example because we're not that far along.
I will just mention that Healthcare Without Harm and Practice Green Health just issued a sustainable procurement guide, and there's a lot of ideas and tips in there. If you're not sure how to find that, it's under sustainable procurement, or you can ask your member engagement manager. I'd like to now pass it back to Scott Rich, and thank you all for your questions, and thank you to our panelists for your expertise.
Thanks, Janet, and thank everyone for being here today. Just a couple of last minute things we wanted to share. The first is on your screen, just a little bit about the Treat Campus Healthcare program that is a program between Arbor Day, the Arbor Day Foundation, and our sister organization, Healthcare Without Harm. So there's more information here for you that'll be in the slides that we'll share. Also coming up, sorry, I'm trying to advance my screen here. There we go, is our culinary contest. So our healthcare culinary contest is happening starting on October 1st through November 30th. So if you'd like more information on that, again, the link is there, and we'll have this in our slides. And then finally, just wanted to mention our upcoming sessions. The sessions coming up, as you know, we decided to do 6 sessions that were curated from what we felt were the best of the best and most timely from our educational sessions that were going to happen at our Clean Med in Orlando that obviously got canceled with the rest of all of our business conferences around the country and the globe this year. So please make sure to check our virtual Clean Med registration page and invite as many people as possible to these sessions. And if you've got any questions, please feel free to reach out via that page. But again, I want to thank all of our speakers today, Mary, Kathy, and Laura, and also Janet and Ben Grover for helping us with the very first virtual Clean Med session today. Thank everybody for being here, and have a great day and a great rest of your week.